Hey, Dr. Currie here. I recently had a patient who was hungry all the time, craving sugar, craving sweets. And then we did blood work, we did some other lab testing. I found some key things that were going on with this patient. And then I put him on the straight and narrow with his diet, doing an anti-inflammatory diet. We were doing a lot of really good things. He was taking his supplements. He's lost about 30 pounds in 4 months, feeling way better, way healthier, more energy, less fatigue, less brain fog. I mean, he's just thrilled with the results of how much better he feels. Now, the funny thing is when he first came to me, he was like, Dr. Currie, I don't really know if I need to do the blood work. Well, all of my patients, I do blood work because if you're not testing, you're guessing. And I run a deep dive blood work with every new patient. Well, he was like, I don't really feel sick. But he was like, I guess I'll do it. So then when we did that, we found some cardiovascular things that were going on, markers of increased risk for cardiovascular disease. And so he really listened to what I said and he followed, and he was a perfect patient. I mean, a model patient. So lost the weight, feeling better, more energy, less brain fog, less aches and pains throughout his body. He was able to come off of his 2 blood pressure medications that he was on, and this is in a 4-month time span. And it's just really been exciting for him. It's exciting for me as well. Now, in one of our appointments, he actually asked me, Dr. Currie, is what you're doing here with me, is there anything in the liver cleanse or anything in the supplements that you're giving me that could be an appetite suppressant? And I laughed and I said, no, heck no, we're not going to do that. But what the situation is that there's 2 hormones, okay? There's the ghrelin hormones, which is spelled G-R-E-H-L-I-N. I kind of almost think of it like the gremlins, okay? Because ghrelins make people hungry. And when people are doing sugar and they're eating a lot of sugar and the sweets and the snacks and their hormones, they're going to produce more of those ghrelins, which then feed forward into more hunger sensations and make them want to go get more sweets and more bad stuff and eat more often, and they're getting more calories in, so they're retaining weight, so on and so on. Now, there's another hormone that's called leptin, and leptin is the hormone of satiety or fullness, of not being hungry. And so many of my patients, when we first start working together, are leptin resistant. Their leptin receptors, they're just not taking it in because they're so ghrelin stimulated and their system is pushed in that direction. And so I explained to this particular patient, I said, look, you're producing less ghrelins, you're producing more leptin, your system is balanced out because the body knows how to do that, and now you're not having all these hunger pains and everything, and you're not eating all the time, which is also part of why you're healthier, less inflamed, and not having all this hunger all the time. And so hopefully this makes a lot of sense to you. If you want to learn more about my practice, go to drcurrie.com. And if you like this video, if you enjoyed it, please give me a thumbs up and subscribe to my channel. And also, I look forward to comments. So leave me a comment if you feel like it. Hope you have a great day.